Hello, everybody. I'm Dr. Vaiyapuri Subramaniam. I'm from the United States. I'm Associate Chief Consultant and Director of Pharmacist Executive at the Pharmacy Benefits Management Services, Department of Veterans Affairs. And I'm also an Executive Committee member with the FIP Social and Administrative Pharmacy section at the FIP. I've been a FIP member for more than 20 years, and it's been a pleasure and a delightful experience to be part of FIP. I've also been in the U.S. Food and Drug Administration, formerly as a compliance officer and a scientist in post-marketing drug surveillance, adverse drug events, and also in the area of pharmaceutical compounding. Previously, I was in professional pharmacy practice as Director of Pharmacy Services, Clinical Pharmacist, Teaching Coordinator, University Teaching Professor, and also Community Pharmacist. It's been a pleasure to be part of FIP and sharing my experiences in a variety of ways to share experiences and also explore our shared visions with pharmacists all over the world, from all different parts of the world, so that we can have common understanding on areas of professional interest, professional challenges, and also marketing our strategies so that we, as members of FIP, can support FIP. At the same time, mutually exclusive types of relationships that we can have with FIP and as FIP leadership with members, so we can make FIP grow from the global aspect of pharmacy practice. Specifically, from my personal interest, I've been working on a couple of things that affect the profession of pharmacy in a number of ways. One of the challenges that I've been involved in, that I share from my past experiences, and also in the United States with the Surgeon General's office as a former Pharmacist Professional Advisory Committee member when I was in the FDA, in the area of public health. The public health roles of pharmacists is increasingly expanding. Pharmacists are taking an increasingly emerging role in public health at the primary, secondary, and tertiary levels, where we can occupy challenging roles in terms of disease management, disease state interventions, and counters from the micro and macro aspects of public health. Also, our roles in the community, in the health system, pharmacy environments, in academia, and also in the areas of public policy are certainly challenging and have a strong role where pharmacists play and where we can find a niche to increasingly exert our roles as members of the healthcare team. And the other aspects of pharmacy practice that also have challenged me to promote understanding is to promote the area of public health in all aspects in the academy. And I've joined many of my colleagues in developing statements of policies in various organizational aspects of pharmacists' increasing roles. The one area that pharmacists all over the world globally can share in public health is to make sure that our roles in the community in any country in the world can be expanded, where we are providing significant and essential services is in medication use, safe medication use, promoting and intervening on adverse drug events, as well as ensuring that patient adherence, and also addressing the areas of cultural disparity, where we can promote increased understanding of our medication use and understanding to patients in any part of the world, regardless of the barriers in language and other challenging changes that we can encounter. The other aspect of pharmaceutical practice where we can share a shared vision is in the area of sterile drug compounding. We know that in many parts of the world, pharmacists do compound either non-sterile products or sterile products. In the United States, we have a large number of pharmacists who do sterile compounding in either the community pharmacy environment or in the hospital pharmacy environment, where to meet essential patient needs where a commercial product may not always be available. In many other countries in the world, pharmacists also share something of this responsibility in areas of either sterile compounding or non-sterile compounding, where products are compounded pursuant to a formulation that may be needed where a commercial product may not be manufactured. Again, here it's important that pharmacists share a common standard, a standardized approach to ensure that best practices in compounding according to USP compendial standards and good pharmaceutical practices are adhered to in terms of sterility, quality, purity from the sterile compounding point of view, or from the non-sterile point of view in terms of best practices, ensure that the product is safe and also taken in the best possible way to meet patients' therapeutic needs. The pharmacists have a shared vision all over the world in this challenge. The other part that I'm also involved in, and which also increasingly has significance all over the world, is the area of pharmaceutical waste management as well as pharmaceutical hazardous drug management. We know that many products, as they are used from product development to product use to disposal, from cradle to grave, have an increasing significant role where pharmacists, as the purveyors and the keepers of pharmaceutical products, can take an increased leadership in terms of making sure that products, after they are extended the use or maybe finished being used and ready for disposal, are properly disposed of and handled so that the pharmacist's outlook and pharmacist's responsibilities are ensured from the environmental point of view for safe product disposal as well as safe disposal of hazardous drugs. The areas of hazardous drug handling have become increasingly important with the possible advent of the U.S. Pharmacopoeia developing standards in the near future in the proper handling and use of hazardous drugs. Pharmacists' use and handling, dispensing, as well as keeping track of hazardous drug use is increasingly important in terms of how they are prepared, where they are stored, whether it be chemotherapy drugs that have hazardous drug potential or non-chemotherapy drugs that are also considered hazardous from the employee standpoint in terms of carcinogenicity, teratogenicity, genotoxicity, and other hazardous concerns. So these things are all of significant pharmaceutical responsibilities for pharmacists to follow, so that we feel that pharmacists ensure their leadership role, that they can also be key players in leadership both at the macro level, policy level, and the practitioner-provider level, so that they, as a team, can play a unified part with each other as members of the pharmacy profession all over the world. Every country, big or small, regardless of location, has pharmacists doing tremendous service to the community. Let us all as pharmacists, from the FIP standpoint as well as the world standpoint, internationally and globally, have a common thread of understanding so that we can go forward in our professional practice, be recognized, and also improve our service to patients, be recognized by patients to know that we are there, the most accessible profession, that we can be recognized as pharmacists in terms of service, quality, leadership, stewardship, accountability, as well as professional leadership, that our presence, our service, qualifications are recognized. And also the other part, of course, is to ensure the standardization of education of pharmacy all over the world, where we can do this forward in more than one way. So as I share this shared visions with you, I'd like to thank FIP and all fellow colleagues for the opportunity that we can, as pharmacists, contribute to each other. And I wish FIP, the leadership, and all the sections the best as we go forward. And as a member of the FIP Social and Pharmacy Administrative Pharmacy section, it's a pleasure to be part of the section. And as we outreach to each other and showcase our role, we look forward to increasing emergence of pharmacist's role professionally, personally, and to be available to all of you. It's been a pleasure, and I am again Dr. Vaiyapuri Subramaniam, executive committee member of the FIP Social and Pharmacy Administrative Pharmacy section, and I'm from the United States of America, located in Washington, D.C., and also occupying a leadership pharmacist executive role in the Department of Veterans Affairs and as a pharmacist executive in professional practice. Thank you again, and wish you all the best.